Can you tell us about yourself and how your journey led to creating Easy Resist?
Yes, so I'm Dr. Lemaire. I'm an emergency physician with a background in resuscitation. I actually have a fellowship in resuscitation. I went into medicine because I was super excited about taking care of the sickest patient of the system. And then at the beginning of my career, I had a very, very tough case where I almost made like a potentially fatal drug dosing mistake. So this is when I realized that we needed to create something to make sure that it never happened again. So this is why we started Easy Resource.
When you first started Easy Resist, what problem were you trying to solve? And has that goal changed over time?
People may not know that, but when you are actually taking care of a sick patient, the challenge is not really the diagnosis. Sometimes in about a couple minutes, you know exactly what you need to do. But the big challenge is the logistical challenge of care. So I want to give this drug, but ultimately, this is like tiny steps that the nurses need to take. Some calculation on how many cc to draw and the mixing instruction and a bit of arithmetics. And when you think about it, every component of the resuscitation is the same thing. I know I need to put a chest tube. So the diagnosis part is easy, but the real tough thing is how do I do this safely as quickly as possible? So Easy Resus is all about solving the logistical challenge of emergency medicine.
Can you share a story or a moment when you thought, this is exactly why we built this?
In fact, the case I have in mind is really the case that started all. I was working in the emergency in the evening shift, like pretty calm shift, and I heard Sebastian scream. And Sebastian is this veteran nurse who's seen it all, like super chill dude. And if this guy is screaming, like a catastrophe is going on. And when I actually look in the hallway, I saw him screaming and holding a tiny lifeless baby in his hands. And usually, when you work in the emergency, you get some kind of call by the paramedics to say, "Oh, in 5 minutes, we come with a 2 year old in cardiac arrest." But here it was completely different. There was just me, Seb, and a dying baby in total chaos. No parents, no information on what is going on. And it's really in that kind of circumstances that you feel completely overwhelmed. You are clearly on the point of freaking out, but you still need to act right now. And this is this case that led to the creation of Easy Recess to try to alleviate all the cognitive load in our brain to make sure that the app just does all this and we can focus on the patient.
What are some of the new features or updates you're most excited about right now?
There is so much cool stuff right now. We're working on Paratus. And the step from Easy Recess to Paratus is going to be a huge, huge one. We've been receiving feedback for the past like 7 years on like what we need to do better. So the first thing is the search. Like I want a search that ultimately, no matter how you phrase what is going on, because when you're freaking out, this is super tough to kind of, oh, I searched like the first dose of midazolam intramuscular for a patient seizing. This is a tough thing to kind of put in your phone and you make mistakes in like the search part is really exciting. We are working with the Canadian Space Agency and NASA on an AI assistant component. Ultimately, the dream would be for you to just say, I've got a 2 year old in cardiac arrest, what's the dose of epi? And you get exactly with the place within the app where the information is. And the last place that I find so exciting is the procedure module. So right now we're pretty good at drug dosing, equipment selection, clinical condition. But we have the chance to have a medical illustrator in our team, which is right now like illustrating over 200 emergency procedures. This is going to be a game changer. Like you want to put an umbilical catheter, poof, here's the procedure. You need to intubate a neonate, here's the procedure. You need to put a Blakemore, here's the procedure. So this is really a big, big game changer for Easy Resus.
What would you say to young healthcare professionals who are just discovering Easy Resist?
I think that it's really like you fight like you train. You know, if you don't use Easy Resus and you just expect that on the day that you'll have a very tough case, you're just going to open the app and it's going to be useful. Clearly, there's a chance that it's going to work. But there's a subset of our users that actually use Easy Resus to train. So they go to their training simulation, they go at home after a tough case and they just rehearse the step to get to the right information. And if you do that, then everything becomes so less stressful because you've got 2 year old seizing, 2 year old seizing, poof, here's what I need to do. So train with the app and take a second just to see all the safeguards we've put in place. Because at the first glance, it looks simple and that's perfect. This is the way. The complexity is under the hood. But if you dive a bit deeper, you'll realize, oh, I cannot prescribe actually tobramycin to an obese patient because the app is going to prompt me to enter the height. So there is an antibiotic weight drug dosing going on. So if you just go on those specific use cases, you'll see all the safeguards that we've put in place to make sure that the app is safe.